Thank you, Dr. Brown, for joining us today. You have been instrumental in being there for the beginning and sadly the peak of COVID. What was that experience like for you?
Um, it was, I think the words I used were harrowing and daunting. I volunteered at the beginning of the COVID pandemic in the response to really, Governor Cuomo called for physicians to come out of retirement. And since my practice wasn't busy, I volunteered to work at Lincoln Hospital. And how was that? That was, I would say it was humbling if you needed to use one word. The reason why is because as a physician, especially as a surgeon, I'm used to curing things or immediately improving them. And that's not the case with COVID.
What was the learning curve like? Because again, we have never seen in our generation a disease like this. It really had nothing to base it on. The novel coronavirus, a different strain. How did you try to learn each day what was the best way to treat the patients that were coming in that were in very critical condition?
So at that time, everything was crowdsourced. I mean, the research that was kind of coming out of Italy at the time and Spain, they were EPUBing ahead of print, meaning they were just putting those papers out as quickly as possible. So a lot of it was crowdsourced. Colleagues forwarded links to, there was a Society of Critical Care Medicine. They have critical care for non-critical care doctors, which was something that I used. I went through each of the modules, and of course, then leaning on colleagues once they're volunteering, but constantly reading and being updated. And even simple WhatsApp groups allowed us to say, hey, we realize that patients actually do better if you put them on their belly. So try to put them on their belly, right? So prone them before considering putting them, intubating them, right? Putting them on life support. Right. Just things like that were really rapidly kind of changing and just spreading throughout our communities through these WhatsApp groups or Facebook groups.
So you felt, and
of course, using science. So it's
yes, the science being the pillar.
Right. It's not like people were just putting random things there, right?
Right. Yeah, using the foundation of science and medicine. And did you find that there was almost a universal community with doctors and nurses working together, even across state borders, of what they could do best for their patients?
Absolutely. I had orthopedic colleagues. Again, I mean, there's a funny meme that says, just stay home if you don't want an orthopedist running your vent.
You gotta laugh in tragedy sometimes. You just have to. It's how you survive.
And, really it was a team effort. Some of my friends and colleagues all the way from Florida were sending up, crib sheets, critical care crib sheets about how to take care of, incredibly ill patients. And also the staff. So yes, you think of doctors and nurses, but it's the respiratory therapists in the hospital. It was the janitors that are cleaning very, very well to try and flip those rooms over. It's everyone. It really felt like a true community, and that we were all fighting against, and we still are, right? Fighting against this virus that was just, devastating to everyone, really. I mean, you look at the numbers globally, but especially to the community I was serving.
As someone who was in the front line of this virus, and it is incredibly frightening because it's still very much here. But especially in the beginning, what was that like personally for you, as you knew you were seeing death all around you every single day and night? Were you ever at a point going, wow, I took an oath to protect human life, but I'm putting myself out there in a way I didn't think I would? You were almost a soldier in so many ways in this pandemic.
I think I rested in my faith. And once Cuomo said that they needed more physicians on the front line and started asking for people from retirement, it almost felt criminal for me not to do anything. Mm-hmm. Using a strong word there, but we spend my entire life, right, to train to be a physician and practicing medicine. And it's a skill that people can't just pick up. right? The pandemic hits, you can't automatically create, thousands and thousands of more new physicians. You have to redeploy and reuse the physicians that have already been trained. I was definitely scared. I mean, I made a decision not to go to a hospital that probably would have been a bit more cush, but really to go to a place where I could walk because I was concerned about exposure. And also, I mean, it took a while to walk, but to make sure that I could have an impact. I speak Spanish, so I wanted to be sure, at the time we weren't following the numbers of how disproportionate it affected communities of color. So I was happy to be able to speak Spanish to some of the patients there. And definitely, I mean, I have an image of my walking over to the hospital, which again was like a 40-minute walk with my family praying with me on the phone to pray to protect me and to protect my hands, and that I'll be able to serve in the way that God ordained me to be.
Wow. That's a very powerful image. And not to mention that you were also dealing with other hurdles, not just the virus itself, but the lack of personal protective equipment, PPE. There wasn't enough. There wasn't enough to protect you. There wasn't enough to protect other frontline physicians, nurses, like you said, janitors who are also risking their lives, patients. How did you work around that?
It was incredibly challenging. I was on an automatic pilot, right?
Mhm.
People are sick and you want to make them better, and we have to figure it out. And so, of course, we're reusing masks that are usually a one-time use, right? Your N95s, and putting them in a paper bag and hoping for the best for the next day, that it'll work by putting something else over it. I am really grateful. One of my colleagues in the ER who I'd never met before at Lincoln gave me a respirator mask, which was impossible to find at the time. I had friends that were traveling around different states calling around for a respirator, the big, black with the two little side pieces, because it was easier to breathe in that for 8 hours. But we didn't have enough gowns. So you're using a gown that you would normally take off once you leave an infected area, right? So infection control precautions, you leave an infected area, you take the gown off, you put it in the trash, you take all your gloves. But at that point, you would take it off and just put it on a chair, and until then you next have to go to another patient that's incredibly ill if they're in one of the seclusion rooms. That's the thing, was it wasn't just the shortage of PPE, it was the shortage of beds, the shortage of space. I mean, you really in the ER had COVID patients everywhere.
Wow.
They weren't in an isolation space, they were everywhere. We were running out of oxygen. I mean, so it was very humbling. I think it was definitely on a form of autopilot, and just trying to move forward, just trying to save lives, just trying to take care of people. It really felt natural.
As somebody who has obviously this experience, an experience that only those who were there can possibly relate to on the level you did, to see COVID-19 become politicized, almost to become a political weapon for different parties, for politicians to say COVID is being exaggerated, to use the words of President Trump. How did that hit you?
I was enraged. And I'm enraged because we're dealing with a virus and science and not politics. So whether someone wants to acknowledge it or not, they're susceptible to it, right? So you can decide that you don't want to wear a mask. That doesn't mean that the SARS-CoV-2 virus isn't going to infect you. Mm-hmm. Or it doesn't mean that you're not going to take that and carry it to someone who is vulnerable and make them ill. And it's really a disservice. I actually think, again, to use my strong term, I think it's criminal to politicize it. Because if we'd been encouraged to use masks initially, the numbers would not be the way they are right now. If we encouraged following science and facts, then we would not have the explosion that we have right now.
Do you feel that doctors and nurses were heralded as heroes in the very beginning of the virus, and then somehow they got mucked into this political discourse? And I've seen it on social media, particularly Twitter, where doctors are stating science, they're stating statistics, and they're getting hit with a lot of controversy and adversity to what they're saying, that they have their own personal agenda. Just, did you ever think that science would be so undercut in today's society?
No, never. I mean, as a society, we should all agree on a set of facts, right? So for this virus and for this pandemic, it's a set of scientific facts that we agree on. And you can then say, well, my approach to that science is different, but you're approaching the facts the same way. Meaning that you view the facts are facts, and the way your opinion of those facts can differ, but the facts are the same. And I really think that's where the beginning of the pandemic is where we see this polarization where, I guess it was Kellyanne Conway who famously said, like, something about her facts. These are alternative facts or something like that. I'm forgetting the term, but you understand that basically once you're dealing with a person, if we, this wall is black, right? But so we can talk about whether you like that the wall is this color or not, but we both agree that the wall is that color, right? That's where our conversation is centered. But no, when you talk about the pandemic and you talk about the virus, people are telling you that no, this wall is orange. How do you even discuss that? Because you're not agreeing to the basics, you're not agreeing to the truth. So it's frustrating because those people are still getting sick. And I have know of patients that were struggling, that were actually dying of COVID and said, hey, he said it was a hoax. And it's like, facts, science. It's unfortunate that people have to suffer because folks no longer follow science and facts.
Right. And and in so many ways, it's pushing a false narrative that is making the general population very, very vulnerable. And they don't have to be if they follow the facts. And speaking of which, here we are in 2021. There is a renewed sense of hope. There are vaccines being distributed. But I mean, personally, and I don't like to interject my personal opinion too much, I don't think we're out of the woods quite yet. We have a long way to go. In your expert opinion, where do you think we're going to be in the next, from now to the next 6 months with the virus?
I think it will remain pretty much the same. When I say that, meaning that we will have to follow the same precautions, because even the rollout of the vaccine has been pretty rocky so far. My hope is that with the incoming administration, they've already outlined a plan and they have some really, really brilliant people working with them to try. And I think President-elect Biden mentioned mass immunizations, a goal for 1 million a day. We can do that. I mean, we've placed people on the moon and everything else. We're capable of doing it. But it really requires a concerted effort. It's patriotic to fight this disease, and it hasn't been framed that way. So the problem now, when we go back to this discussion about facts, is that you'll have, say, mobilization of vaccination mobiles that may go to areas that think that the virus is a hoax. Then will they take the vaccine? And that's, viewing it on a more micro level. So I think that in the next 6 months, particularly the next 2 months, it's going to be dark. There are going to be more deaths. There will be more illness. We have gotten better at treating it. But my hope is that, and even looking at if we have the vaccination, if the immunizations complete at the rate that they should, by the late spring, early summer, we may start to see some normalcy again. But we will go through some darkness before that.
Yeah. It seems, I mean, and I think that's important to hold on to, is that realistic optimism, and to still, like you said, the same protocol, the hand washing, social distancing, wear your mask. If you don't necessarily believe that you're vulnerable, treat it as though someone you love is and wear your mask. Simple scientific guidelines. Now, this is EndoTv, and there's a population watching who has a chronic autoimmune illness. For those that are more susceptible to COVID, how does the vaccine rollout work, at least in the New York City area? I heard there's a second tier of the population that's going to be able to get it. That's the vulnerable populations, right? Can you explain that?
Correct. So the first group that was to receive it were the true frontline workers, the folks in the ER, the folks in the ICU as well. And now we are at the level where I got vaccinated, New Year's Eve, about a week ago. Yay! And my father, who is vulnerable, just got vaccinated this morning.
Awesome.
And my mother's doing it now as well. So that's for the vulnerable population. I think New York's actually doing a really great job. It was very easy to go to the Department of Health and website and sign them up to get their vaccine within 24 hours. So that's something that's important. So in New York, for patients that are immunocompromised, you are able to go to the NYC, I think it's .gov website, and sign up to get your vaccine, and it's free. And it requires very little paperwork. You just need to review the risk and benefits, and then you go and get your shot. So it's been encouraged for those who are immunocompromised to now pursue getting the injection, which would be this wave.
Okay. And in terms of side effects, there are people who are nervous about vaccines, rightfully so, right? There's always a risk. Is there any risks? I know there's two different ones, the Moderna, the Pfizer. Is there any risk that people with underlying autoimmune issues should be aware of with the vaccine, with the COVID-19 vaccine?
So with the vaccine, you should consult with your clinician if you have a history of a severe allergic reaction to prior vaccines. And there were a few cases of severe reaction to the vaccine in the UK, and they're still working that up. But the belief is that it was based on one of the preservatives in the vaccine itself.
Okay.
So for those who are immunocompromised, really, there should be more of a push for you to become vaccinated because you're a more vulnerable population. And the side effects of the vaccines are so minimal. It's 95% effective in reducing getting severe illness as well as getting the virus at all. And the side effects include soreness of your arm. I did a cycle class the day after. I was fine. Some fatigue. And you may even have a very mild fever. I did not have that. And some reactions that could mimic, I wouldn't say mimic COVID, but mimic your body's inflammatory response, your body building up the immunity to fight COVID.
Wow.
So that's what your side effects, they are side effects, but that's your body saying, hey, you gave me this new virus. You don't really get the virus, but you gave me exposure to this new antigen, this foreign substance, and I am building the defense system for it so that if we are to see it again, boom, we can fight it without having such a severe illness. Yeah. I hope I explained that right.
Yes, and that's really incredible, the strides that we've had since March to here we are in January 2021 with a vaccine that is readily available. So thank you for explaining that. I know it's very confusing. There's so much information out there, and to have it broken down so eloquently is very, very helpful. You said, you were you're an orthopedic surgeon, so you were not an infectious disease doctor. This wasn't your beat, as they say in the media world. And you've done a lot prior to obviously being on the front lines of COVID. You just started a new organization that I think is fierce and awesome. Can you tell us a little bit about that?
Thank you. So in July, thank you. So in July, in the aftermath of the COVID-19 pandemic and all of the political unrest about racial injustice, I started Black Women Orthopedic Surgeons, which is a group of, we now number 81 Black women that practice or who are interested in orthopedic surgery in the country. And up until this summer, we never formed or met as a collective body. And just for your reference, there are less than 100 of us in the country out of over 35,000 orthopedic surgeons. So we comprise less than 1%, really. I think the number is 0.8 or below percent of orthopedists in the country. And the group, our mission is to support and empower Black women orthopedic surgeons through education, advocacy, and mentorship. And it's been a wonderful experience, because we're a sisterhood, so about empowering women. Many of us are the one, meaning we are the first, we are the first Black female orthopedic surgeon in the entire state of Illinois. She's alive. She's still practicing. The first Black female in the entire state of Texas, Arizona, all of them are still alive and still practicing. So to get them together, for us to be together in a group, we have monthly Zooms, but we also have some advocacy work we're doing and a mentorship program. It really has been, it's been empowering for us, and using social media, we are a light for others to see that there are physicians, women of color, that are orthopods, women, right? We only account 6% of orthopods.
And when young women are in school, and sometimes you feel limited, you don't even know the career options that are out there for you. And to see women such as yourself that are doing this and are pioneering the way for future generations that can turn around and say, well, if Dr. Brown did that, I could do that too. Mm-hmm. And I think the mentorship is just such a powerful piece in what your organization is doing, because it's inspiring to the next class and the class after that. So you're changing history by this. This is incredible.
Oh, thank you. Thank you. It's the group of us, right? There's a group called Nth Dimensions. This is lifting as we climb, right? We're all still moving forward, and we're trying to bring those along with us. Well, thank you.
Thank you. And I appreciate your time today. Thank you for your service to our country, because that is a service, what you've done, and continue to educate and let people know about this scary time in our world. And I hope that you'll join us again, maybe in the next 6 months, where we will have turned the corner and we have more bright than dark ahead.
Well, thank you. And I encourage your listeners to get vaccinated.
Thank you. Thank you so much. Talk soon, Dr. Brown.
Okay. Bye-bye.